All right, you're live.
Okay, guys, we did it. We did our extractions. Got all the way through. So you can see he's got a little bit of poke spots here and a little bit of inflammation, but pores are both looking a lot cleaner. A little bit of redness, swelling, and inflammation is totally normal the day of because we are going in and putting some work into pulling out that dirt, but I want to show you what all of that oil looked like. And so a lot of these where there's like a dark spot on them and then a lighter spot, that's all of the oil and the sebum that's under the skin, plus some part that oxidized and darkened at the pore surface. And a lot of these are really kind of hard because the oil has compacted. So it's hard to pull some of these out of the skin. For him, the extractions were not too deep. So a lot of them came out really nicely. But again, using the right tools and the right techniques, super important. We did a nice cleanse and kind of prepped the skin. So now we're ready to start our dermal infusion. I do have it set for pore clarifying. So it's on the pore clarifying. So it's going to have really like an antiseptic, something that's going to help to fight bacteria and have active ingredients. And then you can see here that it has a little bit of a rough grit. And so that's going to act like a microdermabrasion. So good for exfoliation, good for some resurfacing. You know, this isn't just an acne thing, but it's a keeping your skin bright, removing dead skin cells, giving you glow, minimizing fine lines. And so the technology, what it does is it creates that suction vacuum. You have a two-way that infuses the water or the serum and then draws out the already kind of dirty serum with all of the dead skin cells, the bacteria, the oils, any little leftover extractions, and contains it. So it's not floating around. Everything is very clean. So here, I'll show you this. So we make contact with the skin, and liquid in a few seconds, there we go, starts to pile into our little tip. And when we release from the skin, it all gets suctioned out, and that's how we keep it really confined and clean. So now, you can close your eyes if you would like. So I like to build up some of the serum on the skin. I want him to be really saturated with all of the good pore clarifying serum. And then we're gonna just do some long, slow strokes to really pull out that oil, pull out the dirt, remove the dead skin cells. How's it feel?
Feels really good.
It's good,
Relaxing,
right?
yeah.
It is relaxing. The grit on the tip is not painful. If you have very reactive skin, you might get a little bit of redness. I respond that way to any sort of treatment, but it goes down fairly quickly, maybe an hour or two, and you leave these serums on the skin. So this isn't something that will wash off after. We'll leave everything on, and then we'll apply our serums and our good mask afterwards. Are there any questions so far? No. Okay, so a little bit about dermal infusion. As I had mentioned, it really is good for everything anti-aging, acne. It's something that you can start kind of at any age. I do have a lot of younger patients who are dealing with acne, and you want something that is not aggressive, non-invasive, but also going to deliver some active ingredients, and this is one of them. So this is a really good thing to do at any point. It's a big staple in our facials, in our custom facials, and also in our laser prep. You know, we want to really exfoliate the skin. So a lot of times in the days and weeks leading up to treatments, we have patients coming in and having their facials done. We frequently combine this with something called the salt facial, which is part of our our laser prep facial, where you can use sea salt to balance out the skin pH and exfoliate away any dead skin cells. It's also good for fine lines. And then you pair it with this dermal infusion because you can then go in and really deliver these ingredients to the skin. Because the surface has been exfoliated, your skin acts like even more of a sponge and just drinks up all of this. So it's a really good duo treatment. So now we're gonna move to the next area. Go ahead and turn your head all the way left. Perfect.
So what are you using for him?
So we're using pore clarifying right now. This is going to be great for just cleaning up basically the whole skin as a surface area. We're going to use this pore clarifying to open everything up and allow anything to be suctioned out because it is like a little vacuum. And then also the anti-acne ingredients that are in pore clarifying, the actives and the acids are going to be gentle enough that when they penetrate into these opened extraction areas, they're not going to limit healing. They're just going to be really good for the antiseptic sake. So he's getting a lot of benefit out of this. And after I do this, you can see how nice and wet it is on the skin. So the skin's going to absorb all of this. And after doing the pore clarifying, I can go in and use brightening. I can use hydrating. This is great for someone if they have like a big event coming up and they just want to put a lot of moisture in their skin. Patients who are traveling before they go on big trips, a lot of them will come in and have this dermal infusion done with the hydrating serum and then put a jelly mask over that, and it really locks everything in even more. Our patients then are the ones who take their face mask on the plane and hydrate as they fly. It's phenomenal. So the other cool thing about this dermal infusion is that they recommend doing long strokes kind of toward where your lymph nodes are. And that really helps with lymphatic flow, detoxifying. So sometimes acne can be a hormone issue, sometimes it's related to diet. And using a treatment where you're pushing everything to this area of the face back here around your ears, this is where all of your lymphatics are going to flow, be excreted, and be cleaned out of the body. So it's kind of cool to have a device that is exfoliating, it's infusing, and it's also promoting lymphatic flow. How's it feeling?
It's really nice.
Okay, good. Okay, turning it back to the middle. Are there any questions, guys?
Nope.
Okay, so again, this is dermal infusion. We're doing it for a little bit of acne improvement, clearing out the skin. We did extractions first, so the skin's a little bit red and inflamed in certain areas, but that'll tone down very quickly. This is a really good treatment for all patients, just anyone who needs the hydration, needs the brightening. We combine this with like our Cosmetic peels because we can do the brightening serums with it, and it feels great. Your skin is glowing after. You can see that he really has some nice like dewy, plump texture and overall appearance to his skin. I'm going to turn you all the way to the right this time. Awesome. Alright guys, well I'm going to finish up what we're doing here and let him relax after all his extractions. If you have any questions, let me know. You know, always here to answer your questions. Just send them in and I'll address them individually. Thanks for watching. Happy Friday and have a good weekend.